This is our case study presentation on BW by Caitlin Shands, Sarah Finseth, Elaine Macon, Michaela Liefeld, and Jazz Belknap. BW has come to the pharmacy today asking for a recommendation to treat the pain and inflammation in his knees. BW is a 23-year-old male that is experiencing knee pain and inflammation after a few hours of spring cleaning. BW states no symptoms of severe acute injury. He has tried icing but still reports pain at a 4 out of 10. He states that he has no drug allergies and is not currently taking any medications. He is concerned about taking acetaminophen as he read it can be harmful to his liver. His coworker with chronic kidney disease also advised him not to take over-the-counter pain medications. Immunizations were not addressed at this time. Per the patient, he has no known drug allergies at this time. Adverse drug reactions were not addressed. We will assess at a future visit. There are no alerts noted, and BW is not currently taking any medications. Additionally, there are no pertinent lab values or objective information at this time.
All right, so upon further assessment, we discussed that his indication is knee pain and inflammation. His goal of therapy is to reduce inflammation and pain level from a 4 out of 10 to a 2 out of 10 in 24 hours. And then the long-term goal is to eliminate inflammation and pain in 10 days. His drug therapy problem is that BW needs additional drug therapy to treat his knee pain and inflammation. Two therapeutic options for him would be ibuprofen 200 milligram tablets and naproxen 220 milligram tablets.
Ibuprofen 200 milligram tablets were recommended for the patient's knee pain and inflammation. The patient was instructed to take 1 to 2 tablets by mouth every 4 to 6 hours as needed for pain, with a maximum dose of 1,200 milligrams every 24 hours. The patient was suggested to start his new therapy as soon as possible, and when taking, to take with food and a full glass of water. Do not take longer than 10 days unless the patient has consulted with his doctor. If the patient notices a worsening in his pain or side effects such as nausea, vomiting, heartburn, and headaches, we've suggested that he contact his prescriber immediately. A few more serious adverse effects to be aware of is the potential for stomach ulcers, which may present as bloody or tarry stools. Additionally, if the patient experiences symptoms of an allergic reaction such as throat swelling, rash, or hives, if you believe that you are experiencing any of these conditions, to seek medical attention immediately and go to the emergency department. We chose the ibuprofen over acetaminophen for this patient specifically because it's a non-steroidal anti-inflammatory pain reliever, and the patient is experiencing both pain and inflammation. Additionally, this medication is convenient to obtain and is available over the counter at a low cost. When comparing safety profiles of ibuprofen and naproxen, it has been found that ibuprofen is less likely to cause stomach upset than naproxen.
Other available non-drug therapy options for BW include using the RICE method. That is rest or relaxation, icing, compression, and elevation. The rest and relaxation is ideal for BW early on so he doesn't complicate his knee pain or make it any worse. Ice and compression and elevation will all help to reduce his swelling. Elevation will also work towards reducing inflammation by decreasing the blood flow to BW's knee. For future prevention, BW should consider wearing knee pads as he does his spring cleaning to protect his joints and provide comfort when cleaning those hard-to-reach areas. To monitor BW's pain, we suggest he keep a pain journal, and we also want to emphasize how OTC pain meds and acetaminophen should not be a concern of his based on his health status. However, people with chronic kidney disease, like his friend, should be conscious about the amount of over-the-counter pain meds they consume because it is metabolized differently for them.
We will follow up with BW in 24 hours to assess and see if his pain has reduced. In addition, we'll assess for any adverse effects such as nausea, vomiting, and headaches. If these are occurring, we will inform him that he should be taking the ibuprofen with food and a full glass of water. In addition, we'll assess for black tarry stool caused by stomach ulcers and an allergic reaction. These are occurring, we will once again inform him he should go to the emergency department and stop taking the medication immediately. We will also assess for the effectiveness using the pain scale of 1 to 10 to determine if he is reduced from 4 out of 10 to 2 out of 10. We will also follow up again in 10 days to assess for pain and potentially refer him to a provider if he is still having pain at this time.
Thank you for listening to our presentation.